Hi everyone, today we are going to discuss about the basic facts of hypertension. We know that diabetes, hypertension, cholesterol are three silent killers, and hypertension is becoming a more and more prominent thing because the prevalence of hypertension is increasing much more compared to diabetes. 40 years and above, 10 people walking on the road, 5 out of 10 is thought to have hypertension. And between 20 to 40 years, young guys and young ladies, 10 girls or young boys between 20 to 40 years walking on the road, 2 out of 10 are thought to have hypertension. But the wonderful thing about hypertension is only 50% of the people with hypertension know that they are having hypertension. If they know that they are having hypertension also, only 50% take treatment. That's the rule of 50. Because suppose a person comes to the OPD, you check the BP and tell it is 140 by 90. Many of the people tell, doctor, I'm stressed out, doctor. I'm driving for 200 kilometers and coming and meeting you. I didn't get the lift, doctor. I'm jumping up and coming. So my BP is high, I'll control it. Okay, he tells that BP is normal. He comes back after 2 weeks and his BP is 130 by 85. So that is considered as a white coat hypertension. Many people come to the clinic and tell, doctor, when I'm sitting in front of you, when the nurse checks my BP in the hospital, it is high. When I go to home, it is normal. So people have a conflict about the hypertension values. Now the European Society of Cardiology has made it very, very clear. Hypertension is defined by where the BP is checked. So understand the values. That is why I gave this talk. Number one, office BP more than 140 by 90 on 2 occasions. You are going to a doctor or a nursing staff, they are checking your BP. It is more than 140 by 90 on 2 occasions. That is hypertension. Suppose you are telling, no doctor, I have stress when I come to the hospital. I'll go home and check my BP using an arm-round machine. Okay, a home BP monitoring you are checking at home more than 135 by 85 on 2 occasions. That is also hypertension. Number third, a person is having stress at checking at home also. He is sleeping, his wife is rotating and checking the BP curve with the home BP monitoring. The nighttime BP more than 120 by 70. So understand three values. Office BP more than 140 by 90, 2 occasions. Home BP monitoring more than 135 by 85 on 2 occasions. Nighttime sleeping BP more than 120 by 70 on 2 occasions. Any of these three is considered as hypertension. Whenever you have hypertension, you have to start treatment immediately because hypertension is the biggest risk factor for stroke, especially hemorrhagic and ischemic stroke or your paraplegia or hemiplegia that occurs. It is believed that 50% of people who have stroke have actually hypertension, and remaining the risk factor of hypertension can lead on to heart attack, kidney failure and sexual dysfunction as well as blood flow occlusion in any pathway in the body. So basically understand hypertension produces symptoms when the BP is more than 180 by 120. So many people have a BP 160, 100, 140, 90. No symptoms. They are walkie-talkie on the road. Once the BP is more than 180 by 120, it becomes a hypertensive crisis, hypertensive emergency. You immediately have to go to a doctor or a hospital and have to take treatment for that. So basically just understand hypertension is on a rise. Whenever you measure your BP more than 140 by 90 in the hospital, home BP 130 by 85 or nighttime BP 120 by 70 on 2 occasions, immediately start treatment. Diet, exercise, weight loss, absence of smoking, alcohol, low sodium, high potassium, high fiber. Suppose you are going for a diet, exercise, weight loss, no smoking, no alcohol, low sodium, high potassium, high fiber, a diet rich in fiber, everything, and exercising, and especially treating your sleep apnea. You have more of snoring, your sleep apnea invariably can lead on to hypertension. You are correcting everything, still your BP is more than 140 by 90, you have to start treatment for hypertension. Once you start treatment, the target BP should be less than 130 by 80. You should aim to keep a BP less than 130 by 80. Always now the guidelines say that once your BP is more than 140 by 90, take on a 2-drug combination. The basic combination is your losartan, telmisartan, olmesartan, sartan with a calcium channel blocker, amlodipine. 10 people having hypertension, 6 out of 10 are controlled with 2-drug combination. Remaining 4, you have to add a 3rd drug also. That's a thiazide-like diuretic, a chlorthalidone or indapamide. 3 drugs, 9 out of 10 people have a good BP control. But still 10% of people, you have 10 people with hypertension, 6 out of 10 will get control on a 2-drug combination. And remaining 4, 3 will get control on a 3-drug combination. Up to 10% of people or 1 in 10 hypertensive people, you are putting on 3 drugs, still the BP is not controlled. Then you have to add the 4th drug, that is now an aldosterone antagonistic, spironolactone or aldactone. The most common hormonal cause of hypertension is no longer thyroid, no longer cortisol, no longer adrenaline. It is aldosterone, the adrenal gland producing hormone of aldosterone. So aldosterone antagonist is spironolactone. Now baxdrostat, the new drug for aldosterone synthase inhibitors, has been approved by UAE yesterday. It will be coming to the market by May, June. Whatever it is, Pharmacotherapy is important for hypertension management. When your 3 drug is not able to control your BP, send the patient to a cardiologist or endocrinologist who is specialized in hypertension management to find out a secondary cause of hypertension. So basically understand this dictum only. Sugar, BP, cholesterol, both are silent killers, or all the 3 are silent killers. But sugar will not kill you immediately. Your cholesterol will not kill you immediately, but hypertension causes mainly stroke. It is just like a pipe that a water is flowing. If the force is low, the water will not come out. If the force is more, the pipe will burst. That is why your BP more than 180 by 120 is a hypertensive emergency that will cause a stroke. And once you know that you are having a stroke, the recovery occurs on only 50% of people. So basically it is the World Hypertension Day. Why did I tell about this? People have so much controversy on the BP values. Many of the people who have a high BP come and tell doctor, office hypertension. I am driving, my BP is high, I am stressed, my BP is high, I am seeing the nurse, my BP is high. So that scenario is totally out. Your office BP, understand, 140 by 90. Go to home, BP more than 130 by 85. Sleeping, BP more than 120 by 70. Something 2 values are high. Go to an endocrinologist, go to a cardiologist, go to a good physician. Start treatment for hypertension. Hypertension can cause long-term complication as well as short-term complication. It is the ultimate silent killer. Your lifestyle may work, but hypertension is on a rise. In young individuals between 20 to 40 years, 20% of people. Elderly more than 40, 50% of people. 10 people walking on the road above 40, 5 have hypertension. About 20 and between 20 to 40, 2 out of 10 have hypertension, and it should be controlled. That's the message of the World Hypertension Day, May 17. Thank you.